So today we will deal about the quinolones, one of the important antimicrobial agents or the bacteriostatic agents. And nowadays it's an era of the quinolones. Many of the veterinarians do treat the diseases with fluoroquinolones or quinolones. Hence, these become very, very important in the treatment of the animal practice is concerned. And the cost wise also, when compared to the other drugs like the cephalosporins, etc., these drugs are very, very cheap, and they are also very effective at the same time. Hence, the quinolones are the groups of the synthetic antibacterial agents. So they have 4 quinolone structure and primarily active against the gram-negative bacteria, whereas the penicillins are effective against the gram-positive bacteria. So these drugs are active against the gram-negative bacteria, but the newer fluorinated drugs like the enrofloxacin, etc., they also inhibit selected gram-positive bacteria. Hence, these are minimally toxic and are becoming important in the veterinary practice day by day. Of course, they are already in the human practice since so many years, in the year 1996 or 66 and onwards. The nalidixic acid and other preparations are in the market, and nowadays it's an era of the quinolones. Entire market is captured by the quinolones are concerned. Hence, coming to a very brief history of these agents. So, coming to the first agent, that is the nalidixic acid. So, it is the first member of quinolones in the 1964. So, this is invented, and usefulness was limited to urinary and GI tract infections, because when it is introduced in 1964, it was the drug of choice for urinary tract infections. So its congeners like the oxalic acid and rexoxacin with more potency but limited spectrum were introduced in the 1970s. And after the 1970s, this is followed by the second generation quinolones, or also they are known as the fluoroquinolones, or they are also the fluorinated quinolones. So these have got the extended spectrum and systemic antibacterial effects. These have, and this is found in 1980s. So about just 30 years is over, especially the introduction of the second generation quinolones. And large number of the fluorinated quinolones have been synthesized and found place in both the human and the veterinary market is concerned. And the quinolones, as usual, as you know very well, that is the nalidixic acid is the first quinolone, nalidixic acid, and the oxalic acid and prosoxacin. So these are all found in 1970s. So these fluorinated quinolones were introduced into the market in the 80s, and now they are the very leading compounds. So the chemistry and structure activity relationships. So it has got a what you call as diverse chemical structures, especially lot of quinolones are there in the market, and they have got the 4 quinolone ring and the carboxylic acid moiety in the position number 3. And if you modify it in the basic ring in several places, then the physical activities, chemical, pharmacological, pharmacokinetic, and antimicrobial activities, all these are going to change. So that's a generalization of these quinolones based on the structure. Anyway, I was going to show you the next slide. The carboxyl group at position 3 and ketone group at the position 4 are essential for the antibacterial activity, whereas the substitution at the position 6 with fluorine moiety markedly enhance activity against the gram-negative and gram-positive bacteria, and also the mycoplasma and chlamydia. Whereas the fluorinated 4 quinolones are called as the fluoroquinolones. So in addition, a piperazine ring at 17 is, so piperazine is a ring at 17 on the fluoroquinolones, that is significantly increases the tissue and the bacterial penetration inside the cell and increases the activity against the Pseudomonas and Aeruginosa. So the examples of this category are the ciprofloxacin and enrofloxacin. Please remember that the enrofloxacin is an exclusive drug designed for the veterinary use only. So the substitution of the oxygen at the atom at position 8 improves the activity against the gram-positive and the gram-negative bacteria with anaerobic organisms without affecting the bactericidal profile. So the change from C form to N position of 8 decreases some adverse CNS effects and increases the activity, especially the gram-positive bacteria, the Staphylococcus aureus, especially the methicillin-resistant Staphylococcus aureus. Coming to the properties, it is amphoteric in nature, means it is ionized at the carboxyl and tertiary amine portions of the molecules. So as the pKa of most of the agents are between the 6 and 6.5, that is the acidic, whereas the for carboxylic group and 7.5 to 8 for the nitrogen of piperogen group. So they exist as the Zutera ions. Zutera ions means both having positive and negative charge in the physiological pH. Then the water solubility is poor, whereas the lipid solubility is very high, and it is between pH 6 to 8. And the concentrated acidic urine, some of the needle-shaped crystals will be formed if sufficient hydration is not given. Then quinolones are available for oral and parenteral administration and can be given as the water-soluble salts or free bases. Then, so this is the structure activity relationship, what we have talked as on it. So here, this is the structure, basic structure of the quinolones. Here you can see that position 2, 3, and 4 are involved in binding to DNA gyrase. So that's the mechanism of action of this fluoroquinolones, which is very essential for the antibacterial mechanism. Whereas in the position 5, it impacts the gram-positive activity. So if it is what you call as repetition with some other drugs, then it is going to cause the effective against gram-positive bacteria. Whereas if it is the position 6, it is involved in the bacterial cell penetration and DNA gyrase effectivity. Whereas the position 7 involved in the spectrum of activity, whether the narrow spectrum or the broad spectrum, and also the kinetic activity. So this is called as the key position, especially R7. And this X8 position involved in the spectrum of activity, including the anti-anaerobic activity. So the position 1 here impacts the PK drug potency and the stacking. So this is the very basic structure, how we can change the structure and how it is going to affect the activity. And coming to the classification, one need to remember that a number of ways these drugs can be classified, either in the chemical structure or the antibacterial spectrum or pattern of the evaluation. That's the generation, first generation, second generation, etc. And most appropriate and simple classification is based on the generation, because it's very easy to put all these drugs in a single category. So they are categorized as the first generation quinolones, or they are also known as the non-fluorinated quinolones. So these are not fluorinated, fluorine item is not there. So these are the nalidixic acid, oxalic acid, pipimidic acid, and pyrimidic acid. Of course, the cyanoxacin is also another first generation quinolone. And the second generation quinolones are the classical example, or they are also known as broad spectrum quinolones. So these are also known as the fluorinated quinolones. So the examples of this category are the enrofloxacin, the number 1 drug at present. It is used very commonly in this veterinary practice. Then also followed by the difloxacin, ciprofloxacin, Orbi, then danofloxacin, morbofloxacin, then of course the norfloxacin, ofloxacin, pafloxacin, then sarafloxacin, then levofloxacin and enoxacin. All these are the second generation of fluoroquinolones or second generation quinolones. So coming to the mechanism of action, so these are having the bactericidal drugs. So tetracyclines are bacteriostatic, whereas these drugs are bactericidal drugs, and they inhibit the replication of the bacterial DNA by interfering with the action of the DNA gyrase. So DNA gyrase is also called as the topoisomerase. So they are the bactericidal drug and inhibit the DNA gyrase enzyme. So that's the important thing to remember, especially in the quinolones. So they enter the susceptible microorganism by passive diffusion method through water-filled channels, and especially in the outer membrane of the bacteria. Then inside the bacterial cell, target the enzyme, that's the DNA gyrase, or it is also known as the topoisomerase, and that is responsible for the supercoiling, means negative supercoiling of the DNA, means winding and unwinding of the strands of the DNA. So simply how we can summarize this thing is, so they are going to inhibit an enzyme known as the DNA gyrase. Then the DNA gyrase, if enzyme is inhibited, then supercoiling or negative supercoiling of the DNA is inhibited. So this is the diagrammatic representation how it is going to act, especially the fluorinated quinolones. So here there are varieties of the channels are there. That's the water-filled channels are there, and with passive diffusion, the drug enters the bacterial cell wall, and bacterial cell after entering this particular thing, especially the gram-negative bacteria through the porins, whereas the gram-positive bacteria through the cell wall. So there is the DNA gyrase is being affected in gram-negative, whereas the topoisomerase enzyme is affected with the gram-positive bacteria. So supercoiling, what is this? Is the supercoiling? So the process of supercoiling of the DNA molecule on itself, so that the DNA up to 1.3 nanometer length can be tightly and compactly packed inside the bacterial cell. So if you just give an analogy that, so if it is not having the supercoiling, then the bacterial DNA will be out of the bacterial cell. So to keep the bacterial DNA very intact inside the bacterial cell, then the supercoiling is required, because the space is very, very less. And negative supercoiling requires first nicking of DNA, nicking of the DNA, and then resealing it after the super twist or passage of the DNA through the nick. Nick means a place where there is a cut mark. That's all. Just imagine like that. Anyway, we are going to see some of the animations. So this is carried out by the DNA gyrase. The number one, the supercoiling, so that the DNA is fitted inside the bacterial cell in such a way that it is having the 1.3 nanometer length, so that it's fitted in. Whereas the negative supercoiling means a nick is formed on the DNA, means a cut mark. Just give an analogy of the cut mark, and it is resealing it after super twist. So there is a lot of twists are there, and this process is carried out by DNA gyrase, and it's also an energy dependent mechanism. So the bacterial DNA gyrase is composed of 2A and 2B subunits. So it is having a special structure of 2A and 2B subunits. So the A subunits carry out the strand cutting function, whereas the B units cause the ATP hydrolysis necessary for the gyrase supercoiling. So the A subunits are primary site of the action of the quinolones. So the two subunits are there, especially in the DNA gyrase, and these are very much required for strand cutting function of the DNA gyrase, whereas the B subunits cause the ATP hydrolysis. So the A subunits are the primary site of action of the quinolones. When DNA gyrase is inhibited by the quinolones, DNA gyrase enzyme, what happens? A reduction in supercoiling occurs. So the reduction means coiling and supercoiling occurs with consequent disruption of the DNA replication. So because of this thing, there is disruption of DNA replication. So the exposed nicks means, suppose you are taking an axe and cutting the tree, a nick is formed, or there are the cuts in the DNA that are not sealed, resealed, also lead to degradation of the DNA into smaller fragment by the action of the exonucleases. So what happens if the DNA gyrase enzyme is inhibited? The bacterial DNA supercoiling is inhibited, and also the nick or the cut mark which is produced on the DNA will not be sealed at all. So what happens? There is a degradation of the DNA and death of the bacteria occurs. Whereas the bacterial DNA gyrase is susceptible at the concentration of the 0.1 to 10 milligram per ml, and susceptible microorganisms lose the viability at this particular concentration within a few minutes. So it is having very potent action. And the mammalians topoisomerase also perform the similar nicking, but the enzymes are fundamentally different from that of the gyrase. So the human cell or the animal mammalian cells do also have the topoisomerase, but the mechanism is totally different and it is not binded by the fluoroquinolones. Whereas the further affinity of the mammalian topoisomerase for quinolone is very, very low. That's 0.001 to that of the bacterial DNA gyrase. Means the fluoroquinolones will come and adhere with that of the bacterial DNA gyrase very easily when compared to the mammalian cells. And the structure of the topoisomerase is also totally different. And this is the mechanism of action in very short, especially the fluoroquinolones. So here there is a DNA gyrase enzyme is there. Fluoroquinolone. Yes, it is a DNA gyrase enzyme, and this is the fluoroquinolone. So what happens whenever a fluoroquinolone comes and bind with that of the DNA gyrase enzyme, then the supercoiling or coiling of the especially DNA, this needs to be supercoiled. Here you can see that it is need to be yeah. So this supercoiling and uncoiling of this particular DNA, it is blocked by the DNA gyrase enzyme. So whenever this, especially the fluoroquinolones come, then topoisomerase 4, it is inhibited, and ultimately the DNA synthesis inside the bacterial cell will not happen. Hence, the bacteria is going to die. So this is the same mechanism. The quinolones come and bind with that of the topoisomerase enzyme. Then the DNA polymerase complex. So the supercoiling here, the supercoiling is inhibited, and also a protein independent protein and protein dependent. So they are not formed here. It is broken down, and ultimately the cell lysis or death occurs. Then usual feature of this particular drug is especially this supercoiling of the DNA and the lysis of the DNA. It's an unusual feature. So at lower concentration below MIC and a higher concentration than the optimal range, and these are active against the susceptible bacteria. And this is called as the biphasic pattern. In the beginning only we had learnt about this. At lower concentration or below the MIC level and at higher concentration, they are effective when in the lower concentration. So this is known as the biphasic pattern and is probably caused by the depression of RNA synthesis at high concentration. So there is a dual mode of the action. So that's the biphasic pattern of the action is there, especially for the quinolones. So this is the mechanism how the quinolones are going to act. So the DNA replication is a very essential. We demonstrate very essential step, especially in case of bacteria, especially in case of the bacterial cell wall or other synthesis, and hence it is one of the important step, especially the DNA synthesis. Hence, the DNA replication is one of the very important step. And here you can see that the bacterial cell, if we cut open it, then we can find here the inside the bacterial cell, there are cell membrane, then cell wall, etc. are there. And this is the bacterial circular DNA. So inside the bacteria, there is a circular DNA is present. So this is important for the function of the bacteria. That's very, very important here. Then, then the DNA replication process, of course, it's very important. And the DNA gyrase enzyme is present inside the bacterial cell, and the fluoroquinolones enter the bacterial cell. So the passive diffusion, and they are going to attach with that of the bacterial circular DNA is concerned. Whereas if you take the particular this thing, bacterial DNA gyrase enzyme, which is inhibited by the supercoiling or uncoiling of the bacterial DNA. So here you can see this particular thing.
The points at which the two strands of DNA separate to allow replication of DNA are known as replication forks. The enzyme's DNA polymerase then moves along each strand of DNA behind each replication fork, synthesizing new DNA strands.
So this is the DNA gyrase enzyme, which is going to coil this particular DNA is concerned. So this is called as the supercoiling, means so the bacterial DNA are
Sir, name voice mate alli PPT sync ಆಗ್ತಿಲ್ಲ.
ಆಗ್ತಾ ಇಲ್ವಾ? Okay.
Which is also known as topoisomerase 2, is responsible for removing the positive superhelical twist. In this animation, we demonstrate the biology of DNA replication, leading to bacterial cell division in a gram-positive bacterium, such as S. pneumoniae. The DNA is shown as a circular double strand within the bacterial cell. Like the DNA of all living organisms, it contains the unique genetic code for all of the proteins required for bacterial survival. Bacteria replicate by a process known as binary fission, whereby one bacterium separates into two new daughter cells. However,
So this is the fluorinated, especially fluoroquinolone mechanism of action. And the thing is, especially the antimicrobial spectrum of this particular these fluoroquinolones are the first generation quinolones, especially this nalidixic acid. They tend to have only a moderately extended this particular gram-negative bacteria, especially gram-negative spectrum. Whereas the spectrum activity of the fluoroquinolone might be considered broader efficacy, as especially on both the type of the bacteria, gram-negative and the gram-positive, and also some mycoplasma and chlamydia are also susceptible. So the type of the fluoroquinolone is very important, and this spectrum is dependent on this type. Then common bacteria susceptible to this fluoroquinolones in small animal include the E. coli, Salmonella, Klebsiella, Shigella, etc. So the effective Pseudomonas, especially this effective against the Pseudomonas aeruginosa and the Staph aureus, which are causing the mastitis in case of cows, and also the Streptococcus microorganism tends to be resistant to most of the fluoroquinolones, whereas these are the not effective against the anaerobic bacteria. You see that these are not effective against the anaerobic bacteria. So the antibacterial activity of the quinolones appears to correlate more closely with the peak concentration than the duration of the plasma concentration or the minimal inhibitory concentration. So they have got the duration of the action, etc. It's dependent upon the type of the fluorinated carbon, fluoroquinolone. So efficacy of this fluoroquinolone appear in part due to the long post-antibiotic effect. So you know what is a post-antibiotic effect, which is concentration dependent. As the concentration of the drug increases, the antibacterial activity increases. But at the same time, we should not overdose the patient. And the size of the bacterial inoculum has minimal effect on the efficacy because the bacteria do not produce quinolone inactivating enzyme, just like the beta-lactamase. It is not going to produce. However, high this drug concentration are necessary to eradicate, especially in the in vitro, the inoculated bacteria. And growing bacteria are more susceptible when compared to the already grown bacteria. And the bacteriostatic drugs may decrease the efficacy of the quinolones. And these drugs are very less active against the susceptible bacteria in anaerobic and acidic conditions. So these are the important two conditions in which the drug is not going to act. And coming to the bacterial resistance, it develops very rapidly, so that the nalidixic acid and other older quinolones have already developed the resistance, whereas it develops slowly and it is of the low grade. And resistance noted is by varieties of the mechanism. The number one is the chromosomal mutation. There is a change, especially the DNA gyrase enzyme, it itself will be changed and the activity will be decreased to, and also the affinity to the quinolones. It's decreased markedly. Whereas the reduced permeability is also another factor which causes the bacterial membrane resistance to the fluoroquinolones. So resistance of this thing, as we have already learned, that the first one is the decreased permeability. The drug cannot enter inside the bacterial cell and bind with that of the DNA gyrase. So number two mechanism, so the DNA gyrase of the topoisomerase, they are totally changed. The binding site is not available for the quinolones. Hence, the bacteria become resistant due to the mutation of the enzymes. And also, just like the other antibacterial drugs, the efflux pump will be activated, and hence the antibacterial drug get out of the bacterial cell is concerned. So this is about the how these quinolones are developed. Of course, it's very small in sentence. So first in 1962, the nalidixic acid, then 1967 oxolinic acid, then starting from the cyanoxin, pipamidic acid, then the especially the norfloxacin, and it developed favorates, etc. So many newer drugs are there, and of course the venofloxacin and sparfloxacin. So all these are developed in the recent 30 years, whereas the second generation agents, especially the agent like the namoxazine, then and entofloxacin, etc., they are developed in 2007. So this is an era of the synthesis of these fluoroquinolones, which take place in 1949, and now as on this year 2018, a lot of antibacterials belonging to this category has developed. So energy dependent efflux of the drug is also another mechanism of the resistance, how the bacteria gain resistance to the drug. And because of the unique mechanism, especially the plasmid mediated resistance is very rare. So that means plasmid mediated means transmission of the resistant gene from one bacteria to another bacteria. It is not there. The cross resistance among the closely related fluoroquinolone has been it's reported. So the apprehension of the developed resistance by the human pathogens has led to a ban on extra label use of the quinolones as food additives. So especially the fluoroquinolones should not be used as the food additives because they are responsible for the resistance development to the human bacteria. So this is the way how the new drug discovery takes place, especially maybe of fluoroquinolones, or it's a very general thing. So in the first 5 years, about 10,000 compounds would be screened. So it involves the varieties of the process like the target selection, the target validation, then lead finding and lead optimization. All these are the steps, especially this takes a very long time. That's the drug discovery process. Then later the drug enters the preclinical studies, especially it takes 1.5 years, and about 250 compounds out of these 10,000 compounds are selected. Then the animal studies are conducted, especially these adverse drug reaction, then the kinetic studies, ADME, absorption, distribution, metabolism, and this elimination studies are conducted. Then toxicity and also the safety studies, they're all conducted, and it takes about 1.5 years approximately. Whereas the clinical trial takes place, especially in the compound. So out of this 250 compound, especially if you take the fluoroquinolones, then 5 compounds will be in the clinical trial. So this clinical trial itself takes about 6 years. See, because all the kinetics, etc. See, the studies conducted here are the toxicology studies and side effects of the drug, safety, and also the dosage form and the efficacy or effectiveness. So this is studied in the phase 1, then phase 2 and phase 3 compounds. In case of phase 1, the volunteers are selected, about the maximum 100 volunteers are selected depending upon the type of the drug, and they are not affected with the disease, and all the characteristic of the drug like the side effects, then the kinetic parameters are studied on them, and the same type of the patients, number of the patients are selected for the phase 2 study with disease or any other element. Then the drug enters the large number of population, especially in case of the phase 3. Whereas after this, it takes about 2 years, especially the FDA approval, and they will apply for the new drug application. Then they require all this data from the preclinical to phase 3 data is required. then to propose labeling up of the drug, and the patenting process, especially patent information and directions for the use. All these are developed and it takes about the 2 years. And manufacturing and commercialization, because this is the phase 4 step, or it's also called as the post-marketing surveillance. Here, only one compound will be there. From 5, it will be reduced to 1 compound. And the regulatory approval, then registration, then active surveillance will be done in case of the last year. So totally how much years? That's 5 plus 1, 6.5 plus 6, 12.5, then 2, 14.5 and 2, 16.5 years is required for the development of a new drug. And now it is reduced drastically due to the modern techniques. Of course, nowadays the new drugs are coming very fastly. And this involves, entire process involves the investment of the very huge money, about $200 billion, American dollars. It is involving, and a lot of manpower, inputs, and so many things are there. And at any of these steps, the drug may fail to show either efficacy or it may show the toxicity. Whereas none of these procedures are followed for formulating the Ayurvedic drugs. And they say that they are very, very effective and no side effect. And never trust such statements, because any drug which is having effect will have a side effect. Then coming to the kinetics part, so it depends upon the type of the drug and the species of the drug. So the absorption in general, quinolones have a very good rate of the absorption. That's the advantage of the quinolones. Then bioavailability of this drug is more than 80%. Then for most of the quinolones, except in case of the ruminants, and the peak plasma concentration will be achieved in 0.5 to 2 hours, especially post administration. This magnesium calcium ion decrease the absorption after oral administration, and food always delays the rate but not the extent of drug absorption. Especially the earlier generation drugs were administered in the empty stomach, but the modern drugs, the recent drugs, are administered after the lunch or the dinner, and the absorption of iron and subcutaneous site is rapid. Then this is the pharmacokinetic parameter just for your reference. So norfloxacin, it's the, after nalidic acid, it is derived, then it is administered as orally and absorbed 50%. Means if you take 100 milligram tablet, only 50 milligram is absorbed. The half-life is 4 hours, then the deposition kinetic is about 20%. And Cipro, both oral and IV, absorption 70%, and the 4 half-life is 4 times, especially in case of the 10 anuria in conditions. So the levofloxacin, all the same thing, oral and IV, levofloxacin, gatifloxacin, moxifloxacin, all are used as oral or IV, and the absorption is very high. That's 89 to 98%. Whereas the nitrofuran, compared to the other drugs like nitrofuran, the oral, then adequate. It is adequate. Whereas the polymyxin, we already learned about the polymyxin, which are effective against the gram-positive bacteria. So both of these are this topical, oral, and IV. So especially the oral absorption is not there. The adults absorbed in the children. So that's the comparative pharmacokinetic of the quinolone with other drugs. Whereas the very generalized summary of the fluoroquinolones is used the route of the administration, both oral and the IV administration is there, and it is especially useful in the infections of the bone, joint, and soft tissue. Of course, the ophthalmic infections are also treated. Whereas the respiratory infections, then like this inhaled anthrax, then mycobacteria, it's also effective. Whereas the other bacteria which are affecting the GI tract and abdominal infections, especially then the irritable bowel syndrome and the SIBO, small intestine bovine, this bowel overgrowth of the bacteria. So this is effectively treated with the norfloxacin. So the mechanism of action, it inhibits the DNA gyrase enzyme and also the topoisomerase 4. That's in case of the gram-negative and gram-positive bacteria respectively. Then the ciprofloxacin is a good bactericidal agent. So it is used in case of the upper respiratory tract infection and also urinary tract infections. Then the adverse drug reactions are the tendon rupture is there, and children below 18 years should not be administered. Of course, the pregnancy, it is category C drug, means with caution it need to be administered. In case of seizures, this should not be used. It may prolong the QT interval of the heart in ECG and may cause dizziness, and sometimes it may cause the excitation in case of certain patients also who already take some of the drugs. So coming to the distribution, with a few exceptions, it is distributed very well into the body. Then all the tissues are affected, then accumulate in the macrophages and polymorphonuclear cells, and this being effective against the intracellular microorganisms. So the plasma protein binding is extremely variable from 10% to 90% in different depending upon the agents. Then the structure activity relationship. So here, if you change the position at 6, then increase in volume of distribution occurs. So increase in the lipophilicity occurs if you change the structure in 5. So if you change the structure in R1, increase the volume of distribution and also bioavailability, same thing. Whereas the R8, half-life is increased and decreased resistance occurs. And if you change in R7, then the increase in the half-life and CNS penetration will be more. So accordingly, the required drugs are manufactured. And the biotransformation and excretion, the elimination depends upon the type of the agent. Especially, most of the quinolones are eliminated unchanged in the urine. Example, the ofloxacin, and partially metabolized like cipro. And the few are completely metabolized like pafloxacin. And metabolites of the few quinolones are active. That's the enrofloxacin undergoes to deethylation to form ciprofloxacin, and some of the parent quinolone of enrofloxacin is also effective. Whereas the renal excretion is the major route of the elimination of the most of the quinolones. And some fluoroquinolones undergo hepatic as well as the renal clearance. So they are excreted from the body or by the renal secretion and results in high urinary concentration. And the alkaline urine increases the reabsorption of the quinolones from the renal tubules and may prolong elimination half-life. Whereas the half-lives of the fluoroquinolones, what is in general, it is 3 to 6 hours. So it is appearing in the milk of the lactating animals, and it is having both advantage and disadvantage. Advantage is being it is a very effective drug in case of treatment of the mastitis. Disadvantage, the milk becomes unfit for the consumption. Then side effects and adverse effects. So they are the older quinolones have got more adverse effect when compared to the newer ones. Then there is a low, these are going to reduce the threshold of the seizures, means the patient becomes more and more sensitive to seizures or epilepsy with chances of convulsions at very high doses. So produce crystalline urea in case of the canines due to their low solubility in the acidic urine, especially most of the carnivores do have acidic urine, and hence there is a chance that crystal urea is formed. They may also cause some of the hypersensitivity reactions in the animals, but it is low when compared to the other drugs like the penicillins, aminoglycosides, etc. All these side effects are very, very minimal. It's countable in nature. Whereas the young animals, if you administer this drug to the young animals, especially in case of dogs and foals, So the cartilage deformities may caused by the chondro destruction and joint growth disorders have been documented in certain cases. Whereas in case of heavy breeds of the dog, the weight bearing joints are specifically susceptible, often leading to the permanent damage may occur. So it is having some chondrotoxicity. So this occurs mainly due to the chelation of the magnesium in the cartilage that affect the selected proteins. So why they are contraindicated in case of young animal? Because the cartilage is developing there and cause the chondro destruction because of the chelation of the magnesium in the cartilage. So the hemolytic anemia is one of the rare side effect. Blindness in the cats is also caused by the somehow rare, but that's caused. So other rarely occurring adverse effects are the GI disturbances, and it is very common with almost all the antibiotics because the nausea, vomiting, diarrhea, and the IM injection cause pain. That is site of injection. So the large doses in pregnant animal may cause the fetal toxicity because it is going to cross the blood placental barrier, may enter the fetal fetal circulation and cause the chondrotoxicity in them, and also CNS toxicity. So pregnant animals, it is not indicated. So contraindications and precautions, especially it is not recommended to the patient hypersensitive to it, and the not recommended especially in case of the puppies or growing dogs under 12 to 18 months of the age, especially in case of small breeds within 12 months or 1 year. So please remember that the any type of the fluoroquinolones, enrofloxacin, cipro, norfloxacin, they are not recommended under 1 year of age of small breeds, just like Pomeranian, Poodle, Dachshunds, etc., and 18 months, especially in case of the bigger breeds like the Doberman, German Shepherd, then Boxer, Bulldog, Rottweiler, etc. So here it is going to cause the inhibition of growth of load-bearing articular cartilage. So they should be used with extreme care in case of the pregnant and patients with seizure disorders. There is a chance that the fetal toxicity may occur, especially it is not going to cause the abortion. Please remember that it's not going to cause the abortion, but there is a fetal deformity of the cartilage. So the joints will not be formed properly and the cartilage will not be grown properly. So as quinolones have the tendency to cause the crystalluria in acidic urine, animals should not be allowed to become dehydrated. Always the watering is very much required. Then the patients with the renal insufficiency may require dosage adjustment to prevent the drug accumulation. Then the drug interactions, few are there, but these are the potent chelators of the magnesium and calcium. So non-systemic antacids may interfere with their absorption. If you are taking the diazine, gelicyls, and so many antacids, then if you take these tablets along with them, then there is a chance of the chelation. And probenecid is reported to block tubular secretion of some of the quinolones, very similar to that of the beta-lactam antibiotics, and it may increase their blood levels and half-lives. So the quinolones inhibit the biotransformation of the theophylline, especially resulting in its prolonged and potentially toxic level. So if you drink the tea or coffee along with that of the quinolones, then it may cause the potentiation of the effect. Means there will be little this excitation may be there. So you can also feel like particular thing and you can test it. It is not fatal. Then a combination of fluoroquinolone with NSAIDs increases the potential of the fluoroquinolones and to lower the seizure threshold. Suppose if you have used this in case of an animal with pre-existing history of the seizures, then it may increase. That's also there. and synergistic effect of this drug in with beta-lactam, then aminoglycoside, then clindamycin, or the metronidazole. All these have been reported very well. Then the clinical uses of the quinolones are like nalidixic acid. It is used as the urinary antiseptic, means it is going to cause the death of the, especially the bacteria in the acidic urine. Especially that's why they are called as the urinary antiseptic. And this is very effective in the treatment of the local and systemic infections caused by the susceptible microorganisms, and particularly for the intracellular and deep-seated infections. So the respiratory tract infections, intestine, urinary tract, skin, and prostate gland infections are usually treated with the quinolones. So also useful in the treatment of the meningoencephalitis and also the osteomyelitis and arthritis. But not, suppose the cough, there is an arthritis, then don't use it because it is going to cause the chondritis. Then coming to the first generation cephalosporins, not quinolones, or they are also known as the fluorinated quinolones or fluoroquinolones. So the first agent is the nalidixic acid. So this is a non-fluorinated quinolone used primarily as the urinary antiseptic. So no other systemic activity is there. So it is active, very effective against the bacteria which are causing the cystitis, urethritis, and many more urinary tract infections. So they are effective against the gram-negative bacteria, especially the E. coli, Proteus, Klebsiella, and Enterobacter. Still, the E. coli infections, especially in the UTI, is treated with the nalidixic acid because it's one of the most old agent. So the gram-positive bacteria and also the Pseudomonas and anaerobes are not susceptible, especially nalidixic acid. So it's the first drug. Nalidixic acid is very well absorbed orally. That is, more than 90% of the drug is absorbed after oral administration and has the very high plasma protein binding. That is the more than 90%. So you know why, if there is a more plasma protein binding, means the less free drug is available at the site of the action. Then it is partially metabolized nalidixic acid in liver by hydroxylation to a more potent bactericidal compound, that is 7-hydroxynalidixic acid. This is one of the potent compound. So this is excreted in the urine along with the parent drug. So this is not effective as a parent drug. That's why it's called as the prodrug. Then it is converted to potent bactericidal 7-hydroxynalidixic acid. So some nalidixic acid is conjugated in the liver, and also due to the very high plasma protein binding or ppb, the plasma concentration of the free drug is inadequate for the treatment of the systemic bacterial infections. So it is not used for the systemic bacterial infections other than that of the UTI. However, high concentrations of the unchanged drug and its active metabolite in the urine are secreted, which is up to the extent of the 20 to 50 times than that of the plasma. And these are bactericidal for common urinary pathogens like the E. coli, Klebsiella, etc., which are gram-negative in nature. Then this is the structure of the nalidixic acid, and also the side effects or adverse effect of the nalidixic acid. Of course, most of the general side effects associated with nalidixic acid include the nausea, vomiting, and a severe abdominal pain. Whereas this is sometimes is very specific, that the photosensitivity may occur, and which causes severe urticaria or itching, and central nervous system problems and fever may also be seen in case of some of the human patients, but it is, of course, it is very rare. And therapies lasting longer than 2 weeks can adversely affect the liver function. And this is primarily used as the urinary antiseptics. Of course, there is a separate chapter is there, urinary antiseptic drugs, especially this is very effective against the UTI, urinary tract infections. So this is rarely used to treat the colibacillosis in case of cows, whereas the modern drugs of enrofloxacin, etc., they are effective. So this is not ideal for this purpose. In humans, it is considered to be useful in the treatment of the ampicillin-resistant Shigella enteritis. This nalidixic acid, apart from that of the urinary antiseptic action, it is used to treatment of the ampicillin resistance Shigella caused enteritis. So the dose of this drug, especially in the urinary tract infections, UTI, so 3 milligram per kg, 4 times daily for 5 to 6 days. That's the normal dosage. Then the other agent is the oxalic acid. It's a non-fluorinated first generation quinolone with the same mechanism of the action when compared to the other fluoroquinolones. So it's also going to bind with that of the DNA gyrase, then the DNA supercoiling and uncoiling will be inhibited, and also the nick cannot be healed properly. Then the DNA synthesis is going to stop, then the bacteria is going to die. And the antibacterial spectrum is also similar to that of the nalidixic acid. Of course, both of these are one of the ancient fluorinated quinolones, these quinolones. But in addition to gram-negative bacteria, it is somewhat active against the Staphylococcus aureus. Then oxalic acid has been associated with very high incidence of the central nervous system toxicity. So CNS toxicity like the confusion, bizarre behavior, convulsions, all this may be seen rarely. But presently less used domestic animal, but it is used very commonly in the treatment of certain fish diseases. So please remember that many times the fish may be, especially fish ponds, etc., the veterinarian may be instructed to visit the fish pond and advise a suitable antibiotic for different disorders. Then oxalic acid is one of the choice of the drug. Then this is the structure of the oxalic acid. And other non-fluorinated quinolones like the pipamedic acid, pyromedic acid, and sinoxacin are the first generation non-fluorinated quinolones. These are all the first generation. Like, so nalidixic acid, then the other drugs, especially the pyromedic acid, sinoxacin. These are all the first generation non-fluorinated, because in the structure of these agents, fluorine is not present, and hence they are going to be called as the first generation agent. So they have limited activities, and then nowadays, because of the arrival of the newer drugs, these drugs are very less commonly used in case of the veterinary practice is concerned. And now it's an era of the especially the fluorinated quinolones or the fluoroquinolones. So this is about the first generation this quinolones, and we will